Well, all right. Well, welcome back to Health Made Easy. I'm your host, Dr. Jason Jones, and super excited for our guest today, Dr. David Shirazi. He's an innovative sleep expert. He's also a functional dentist and a very experienced acupuncturist as well. But some of you guys may have never heard of him, may not know who he is. So what I'm going to do is just have him introduce himself, tell you guys a little bit about his background, and then we're going to dive into this amazing topic of sleep and sleeping better. Doc, take it away.
Thank you so much, Jason. So yeah, in 2000, I became a dentist, and then 6 years later, I became a Oriental medical doctor with, acupuncturist and herbalist. And ever since essentially 2001, my practice has been focused on functional orthodontics and treating orofacial pain and snoring and sleep apnea. Okay. That has been my focus. Mm-hmm.
Awesome.
And for 5 years, I was a sleep technologist. The technologist is the one that conducts the sleep study when you spend overnight in a sleep lab. And then I have a master's degree in psychology.
Oh, okay.
Mm-hmm.
All right. So let me ask you this. When we look at a good night's sleep, that's kind of subjective, like what would you define as a good night's sleep? Like, how would we know if we actually had a good night's sleep, or is there a way to measure whether or not you
that
actually
is
had a good
such a good question, man. No one asked me that question. That is a really, really pertinent question. So truthfully, the only way you can measure your sleep is with a sleep study, right?
Okay.
An in-lab or an in-home. And in-home, they don't measure your brain waves that much. Their focus is more in your airflow, if you have snoring, if you have sleep apnea, if you have interruptions in your breathing, and if it causes any jerking. And in-lab study, they measure everything like leg movements, brain activity. That's we call them intrusions into our sleep and arousals. So the in-lab study is far more detailed, but I don't want to use the word invasive because it's not at all invasive. They're not sticking anything in you.
Mm-hmm.
But when you're getting an in-lab study, they put sensors on your head and, nasal cannula and a pulse ox and something on your chest and something on your legs to see if you're jerking your legs. And they collect more data in an in-lab study than any blood test you can imagine. Oh. It's imagine 20 streams of data, right? Your brain wave, your heart wave, your breathing, just all of these things that's collected for as many hours as you sleep, right? Okay. There's nothing that compares to that. It's a tremendous amount of data, and working with a good sleep physician that can actually interpret what's going on, making sure you're getting a good sleep. So good sleep is, for an adult, is when you're getting at least 25% of your sleep in delta and 25% of your sleep in REM. Okay.
Yep.
Delta is a stage of sleep where we get almost 100% of our growth hormone. Right. And after we grow, we need growth hormone to repair.
Yep.
So incredibly important physically. And REM is where we do our mental and emotional processing. Right. So we've definitely seen sleep disturbances, whether it's insomnia or sleep apnea or snoring, associated with depression and anxiety. And it's not just a correlation, because when these people have both, and then we resolve the sleep issue, we notice their depression and anxiety either is gone or gets better.
Okay.
So there is a strong, I don't say this to sound like clickbait. Sleep is more important than diet and exercise.
That brings a question to my mind. So I would imagine that the majority of the people getting the sleep study aren't necessarily they don't get a pass. It's not like they're getting an A+, I would imagine, on their sleep. Do you see people?
It depends. Yeah.
Okay. Do you see people that are, that struggle losing weight? Like, they are dieting, they are exercising, they're weight loss resistant,
Yeah.
those kinds of things. Do you see that where they're delta sleep, where they're not producing the growth hormone, which I
Well,
think is in part is to like keep you sort of lean and
yeah,
in better shape? Is that, do you see that as like a common denominator?
we see it as a component because when someone has interruptions in their sleep, we see what's called a hormone called ghrelin, which makes you hungry, get
Mhm.
kicked up.
Yep.
60 Minutes, like the show 60 Minutes, by the way, used to be an excellent show. I think they're a total fraud now. But for decades, they were just a wonderful source of truthful knowledge. Like they were a great show. I don't know what happened in their ownership, but now I don't trust them. But a long time ago, like a decade ago, they did a case study with a healthy young man, looked like you actually. And he was like a high school, college athlete. And they did a sleep study on him, and he had like perfect sleep, great sleep. And they did blood work on him, perfect blood work. Everything was healthy.
Mm-hmm.
And all they said was, okay, so we basically want you to stay here in the hospital, and we're just going to do sleep studies on you. I think it was for a week. Yeah.
Yeah.
And what they did was they waited for him to get into REM and Delta, and they rang a bell.
Oh.
And you could see him like while he's sleeping, he'd like, he never woke up, but he went from that deep stage of sleep to a lighter stage of sleep, and they could measure that.
Mm-hmm.
And they noticed that in that week he's eating more, right? Putting on a little bit of weight. And they asked him, like, so do you think you're eating the same, more or less as before this project? And he goes, oh, I'm definitely eating the same, right? Because, most people don't weigh their food day in and day out.
Yeah.
And of course, a young, healthy man is not going to at all. So he went by feel, like, oh, I'm going to eat until I'm full, right? And that's what he would do. He would eat, and then, but he didn't realize he was hungrier than he was before. So at the end of the study, they redid his blood work. They took his blood pressure, and his blood sugars went up, liver enzymes went up, and his blood pressure went up too. So not after a week, not to the level of being diabetic or being extremely hypertensive, but the fact that after 1 week, they took a perfectly healthy kid and made him pre-diabetic and pre-hypertensive is very telling. It tells us the importance of sleep. And I don't know of a single food or a diet exercise that if you get wrong or if you ignore, that will raise your blood sugar like that in a week, and your your blood sugar. So yeah, the sleep is extremely important.
Yeah. And gosh, I mean, just 1 week. I mean, imagine, because you're seeing people that it's been
Years.
months, years,
Oh yeah.
decades, they have
Mm-hmm.
not slept well, that,
Mm-hmm.
and their health is probably in the tank,
Yeah.
really not doing well, because they can't be coming in with this like, well, I just don't sleep well. I'm sure they have
That's
multiple
right.
health issues, from there. Um,
Yeah.
Let me ask you this.
Yeah.
Sleep, it's been going around, certainly in our circles, for a very long time.
Mm-hmm.
In the medical community, it's been going for a while. A lot of guys doing sleep studies, those kinds of things. Probably not to the degree that you're talking about doing. Um, and it gets a lot of press, and there's all these sort of basics, that people should be doing, or that at least we're told to do, that actually help improve sleep to some degree.
Yeah.
What are some of the ones that you might recommend for someone who just, they've never even heard of, sleep hygiene, or any of
Yeah.
these basics? What are some basics you'd tell us about?
So some of the like tried and true sleep hygiene basics are super dark room.
Yeah.
You want the room very, very dark. Okay. And you told me you're in a rural area of like North Carolina. So fortunately, you will have that darkness. Bless you.
Yeah.
You want the room cool. It's better to be colder than it is warmer. So 65 to 70 is the ideal sort of temperature for the average person. And then you can take as much blanket as you need to warm up after that. And then also socks is fine to wear when it's cold. Quiet. right? You want to keep those dogs quiet. You want to make sure you don't have noisy neighbors. This is my one recommendation that makes people the most upset is when I tell them not to sleep with the dogs in their room or their cats. Okay, they take it as a personal offense. I might as well just taken a whip and beaten their children is what they feel about it. And my point being is, they move in the middle of the night. They fart. They jump on you. They do things. They knock over things. And when they do, that kicks you out of those deeper stages of sleep, just like that bell did in that study.
Yeah.
Plus, they sometimes lay in your chest. Sometimes their dander will swell up your what's called your nasal bodies in your turbinates and your vomer in your nose, which switches you to mouth breathing, which then causes a whole myriad of problems. When you switch from nasal to mouth breathing, it causes a whole multitude, like a cascade of problems. So, and of course, these are animals that are usually outside. Some of them stay in, but they're rubbing up against the ground where it's dirty, and then they're jumping on your bed where it's supposed to be clean. It doesn't make any sense logically, but I understand they're the extensions of the family. But to me, sleep is more important.
Oh yeah, most definitely.
Yeah, we used to have a cat, a Siamese cat, that would meow at the front door, at our bedroom door, right? Just because he loved my wife and he wanted to be with my wife, and he wouldn't get the message. So he hated his little cat carrier. So I put the cat carrier right in front of the front door, right? And I heard him hissing, and he never meowed at the front door again, So some things you just have to do. Dogs and cats will take offense if they've been used to sleeping in your bed, and now you want to take them out. They will take offense to that, right?
Yeah.
Now,
yeah. So
probably.
Go ahead.
I was going to say probably the biggest thing that is not talked about enough, that is critical in our modern times, is the blue light, right?
Yeah.
So we have something called a circadian rhythm that determines when we're supposed to wake up and go to sleep based on hormones. And the brain determines this, and the brain determines it by the amount of sunlight it gets, okay? The brain cannot determine the difference between a photon of light from the sun or from the phone that we've been looking at before you go to sleep.
Yeah.
So either you totally stop with the phone or the iPad or the TV, or you wear blue blockers. Those are the very dark orange looking glasses, very dark. The light ones are not enough. It's got to be dark. And you put your phone in like that night mode, starting at like 8 p.m. or whatever you wish. And then on top, I do all three of those things. I got the night mode, I got the glasses, and I have like this thing called the privacy screen. I have like a screen protector on my phone. And it's one of those screen protectors that when you're looking at it, it's fine. So it's basically a polarizer. It's fine when you look at it, but when you look at it to the side, you can't see anything.
I gotcha.
Right? So it's basically a polarizer. And that seems to make a big difference in the amount of light we get. I have a lot of patients who they think they have insomnia, but they don't. They have what's called a circadian rhythm shift. And what that is they have a hard time falling asleep, but then they stay asleep and they wake up late. Right? So that's not really primary insomnia. That's really a circadian rhythm shift.
Okay. So you talked about the difference between nasal breathing and mouth breathing. And I know that what I'm going to ask you, for some people, one, they've never heard of this before. Two, it might be a little bit controversial depending on who you're asking. But what's your take on mouth taping?
I love it.
Okay.
I love it. I've been recommending it for, 15 years. So the technique in which I recommend it is because we don't want people to get anxious, right?
Yeah.
So I recommend a V like this.
Okay.
Right? So that you could rescue breathe in the middle if for whatever reason your nose stuffs up in the middle of the night, right? Obviously, if someone has anxiety, if someone has claustrophobia, if someone has acid reflux, these are what we call contraindications. You should, definitely talk to your doctor about it.
Yeah, makes sense. Yeah, because
Mhm.
the funny thing is in the fitness community
Mhm.
that this is like been done for a long time. It's like
Yeah.
people train in the fitness community with just nasal breathing. I've heard stories of back in the day in certain Indian cultures they would have young boys. The way they would find out that they were like a man is they would have them hold water in their mouth and run, like these long distances, and only breathe through their nose. And they had to come back with the water still in their mouth. So it's
Yeah.
like certainly great for fitness, but I think also, like you said, nasal breathing is really great for sleep, as well.
It is. We're actually only supposed to use our nose for sleeping.
Hmm.
The mouth is only for talking and eating, right? And there is the top athletes. One of their training regimens is they'll carry a big stone up a hill. Okay, a small hill, but still. And the best athletes do it while taping their lips. Right.
Yeah.
And you can imagine the kind of force and that you can exert, and you're basically training your lungs, because we want to maintain a certain level of carbon dioxide in the body. And when you mouth breathe, you get rid of carbon dioxide. And the problem with that is if you have too low carbon dioxide, then the oxygen will not liberate out of your hemoglobin.
Gotcha.
Yeah. So by nasal breathing, you maintain a slower breath rate, which keeps your end tidal CO2 within 35 to 45 millimeters of mercury. Yeah.
Okay.
And which then, I mean, it doesn't matter. Like, here's the irony. It doesn't matter if you have a 99% oxygen saturation if it doesn't come out of the blood. If it doesn't come out of the red blood cells, what's the point?
Right.
Right.
Yeah. Like it doesn't matter if you eat organic if your absorption and assimilation in your gut is terrible.
Exactly. Good point.
Doesn't make any difference. Yeah.
Exactly.
So
Good point.
let me ask you this: if we were to dive into maybe some complex conditions or maybe some things that are people just wouldn't think about that affect their sleep and affect the quality of their sleep,
Okay. What would you like to know about?
outside of the dark room and the cool room and the cutting off the electronics and things like that, what are some things that people, I would say, maybe you find these that are relatively common but people just don't know about them, that could really be putting a burden on a person's sleep quality?
So my focus is on snoring and sleep apnea.
Okay.
And that's the biggest thing I see. Okay. And, they did a study on not just snoring and sleep apnea, but the bed partners effect. Okay.
Mm.
So the Cleveland, I named it secondhand snoring. Yeah. So the Cleveland Clinic did a study. I think they started with like 1,000 people or
Mm-hmm.
1,500 people, something like 1,100 people. And they did the sleep study on both bed partners, right? And I'm making a generalization just to make it easier to tell the story. But let's say it was the men that had the sleep apnea and the women that didn't. Okay. And the average male that had sleep apnea had what's called 27 arousals an hour. The arousal was when we get kicked out of that delta or REM sleep, right?
Mm-hmm.
And that is the part that causes the vast majority of problems, is the arousals. Okay. Now, the bed partner with no apnea, roughly, had 21 arousals an hour, right? From either the snoring or the silence in their bed partner, because silence means you're choking.
Okay.
Right? So whether it's conscious or unconscious, the bed partner would have a bit of angst with the bed partner snoring or silence. So of these 1,100 people, they whittle it down to 150 that stuck with the CPAP, right? And just on a side note, a CPAP works tremendously well, has over a 99% success rate when used properly, but has a less than 50% adherence rate. Right? So that's something that needs to be addressed with your doctor. And you have to be given the option of wearing an oral appliance instead, or having ENT surgery instead, or being treated for weight loss instead. But, CPAP is a great choice, but it is not the only choice, and it shouldn't be forced on people. You should be given all the options, and your options, your needs, your individual needs are going to vary, right? So anyway, I digress. These 150 people that stuck with the CPAP, they didn't do sleep studies on the spouses, but they asked the spouses, so how are you doing with yourself now that your bed partner has a CPAP and they're no longer snoring or no longer having sleep apnea? Well, they reported anecdotally that their headaches are gone, their moods are better, they're not depressed, they're not anxious, they have more energy throughout the day. They just mention their overall quality of life has greatly improved, right? And nothing happened to them. It was literally their bed partner that was given the CPAP. So I think probably the biggest culprit, this is the problem with anything that happens in our sleep. We are unconscious. We don't know what's happening, right? A common problem I see is I hate to say it, with men, is we're very stubborn when they're told, hey, you snore, you have sleep apnea. And they're like, no, I don't. Right. And I actually do recommend that their spouses record them with their phone and then show them, like, this is what you're doing in the middle of the night. I know you don't know because you're asleep.
Yeah.
And I'm afraid for your health. And you're on high blood pressure medication, you're on diabetes medication, you had a history of a heart attack or a stroke, there's Parkinson's going on here. I really think we should address this for your quality of life. I think it's a fair thing to say.
Yeah, I agree 100%. So when you talked about the CPAP having a 50% adherence, is that more that they just don't do it, or they
don't like it,
or they're wearing it incorrectly?
Well, that could be it too. But the compliance issues are around comfort. They could have an allergy to the latex material. The CPAP machine makes noise too. Mm-hmm. So either they don't like it or their bed partner doesn't like the CPAP. It could leak and be blowing air into their eyes, or something. Plus, there's a stigma around wearing a CPAP. I've had patients tell me to my face many times that, doc, they said they are a divorced 40-year-old man dating, right? They're like, I can't put that thing on after a date. I've had females tell me that. I mean, there's a bit of a stigma associated with it.
Yep.
Right. I get it. If you don't want to do it, fine. An oral appliance is something that's easily tolerated, right? It's like wearing a night guard or a retainer. Mm-hmm. So you wear that, keeps, knock on wood, it keeps your airway open. Please make sure to get a follow-up sleep study with your oral appliance. Make sure it's working. It's a big deal. And you can have a treatment that works for you.
Yeah. And because you mentioned there are other options other than the CPAP. So what are some of the other options that somebody could use if they either were going to be non-compliant, or maybe the CPAP just didn't fit them, it didn't work well, or whatever? What are some other options they can do?
So I always say it depends. Some people have blocked nasal passages. It could be your nasal valve, could be your turbinates, could be your tonsils and adenoids. Some people are just overweight. And just some people have a very large tongue, or they have a tongue tie. I would say a large percentage of the population, they don't have enough muscle tone in their upper pharyngeal and their neck muscles. Most Americans are pretty sedentary, as are Australians and the British. Yeah, those are the big ones. And the alternative to the CPAP would, number one alternative is oral appliance. Number two is nasal surgery.
Yeah.
Number three, you could say, is like myofunctional therapy, where you're just going to tone up the pharyngeal muscle tone and the tongue tone. And then now they have implantable devices that you attach to your hypoglossal nerve that basically, it's like a pacemaker. It's like something that they use to shock your heart, but they're shocking the hypoglossal nerve to put some tone back in the tongue so it doesn't flop back into your throat.
Wow.
Yeah. So there's lots of lots of things you can have done. You are not beholden to only getting a CPAP.
Okay. And then I've also heard that because of, and as a functional dentist, you probably can speak very well to this, because of how soft our food is from the time we're born up until now. It's like we're not chomping down very, it's strongly on steak and whatever that it is, that's has really affected like our jaw, our facial features and those kinds of things. Yes. And that has led to the issues with the sleep and the mouth breathing and the thing. What are your thoughts on that?
I mean, it's spot on, but that's predominantly to do with children. Okay. And the growing child. So for example, when we look at skulls prior to the Industrial Revolution, we see that these people have wide palates, big jaws, right? They have straight teeth, because one of the number one reasons for crowded teeth is some kind of sleep breathing problem or just a breathing problem.
Yeah.
And they have that much space, like a quarter of an inch space behind each wisdom tooth, right? Because their palate is so wide.
Yeah.
And the chewing, so we get our baby teeth starting around 6-7 months, right? And 300 years ago and beyond, there was no processed food. So you gave that child whatever they could eat as soon as those teeth came in, and they had to chew it. And when you do that, it develops the height of your mandible, right? And that height determines how much space you have for your tongue on the front back sort of, top down volumetric. We call the vertical dimension.
Yeah.
And then they breastfed for 3 to 5 years, right? In fact, I went to a conference recently, and I saw a study, make me sigh, where they showed, like, in children, they were like toddlers, they're expanding the palate using a surgical device and talking about all these benefits, right?
Yeah.
And I just turned to my friend, who's also a dentist, and I just rolled my eyes and I said, a boob is so last century. Why would you want to breastfeed the kid? You know what I mean? When
God
you can
forbid.
just screw an implant into their palate, into their nose, and then expand their, I can't even think about it.
No, it doesn't make a whole lot of sense. That's for sure.
That's right.
So as a take-home message for the folks today, yes, we've talked about some practical steps. Darken the room, cool it off, turn the phones off, or wear the blue block or the blocker.
We should wear the blue blockers anyway, because even if you're not on your phone, you usually have your lights on inside your house as you're walking around. So I walk around the house with my blue blockers all the time.
Yeah. Yeah, because it's either that or change out all your light bulbs to like a red bulbs, right, or something like that.
You're right. You don't want to.
No, nobody wants to do that. Yeah, it'd be a little weird.
I always tell people, right? I always tell people the reason why I wear glasses instead of contacts is so that I can rip them off dramatically and say, "God damn it, Bob, I said no." And you can do that if you don't even wear glasses. You can do that with your blue blockers.
Very true. Dramatic effect. I love it. Well, if folks could do, let's say 1, 2, or 3 things to have a dramatic effect on their sleep, what would, outside of those ones we already talked about, what would you have them do?
So make sure your nasal passages are cleared before you sleep. So
Okay.
you can use a nasal rinse. I have my own nasal spray that I make with essential oils,
Okay.
but even just a saline nasal spray that you can buy over the counter, clear up your nose before you go to sleep. Number one. Number two, wear something, because we live in very stressy times, right? These last, what, 20 months has been very stressy.
Yeah.
So people are clenching their teeth. And even
Mhm.
though sleep apnea is one of the reasons why we clench our teeth, I mean, I don't recommend anyone watch the news, but if someone does watch the news, that'll make you go clench your teeth, right?
Mhm.
So wearing an appliance that's a sleep apnea based appliance to help you with the clenching is huge. I think that's enormous.
Yeah.
And do a mental health exercise, like a ritual before bedtime, right?
Okay.
Watch a Reiki video on YouTube, watch a meditation on YouTube, you know, binaural beats, you know, on YouTube. You know, there are people like Brad Yates that do this thing called tapping.
Yeah.
And when they do it for things like anxiety, people that have a hard time falling asleep, they just conk out. It's really great.
Yeah.
So there's a lot that we can do. There's a lot that we can do that. And I'm sorry, all those things I just mentioned, you won't get from your physician.
No.
Right. So there are some things that you're going to have to like make the step forward.
No.
And I have a colleague in Raleigh. I don't know how close you are to Raleigh.
2.5 hours.
2.5 hours.
Yeah.
I have a colleague. His office is called the TMJ and Sleep Therapy Center of Raleigh. Like my two offices, the TMJ and Sleep Therapy Center of Los Angeles and Conejo Valley. You know, there's a lot of information on my website, tmjla.com. I did a 1-hour Google talk where I kind of discussed these things in children and adults. So I've got 30 testimonial videos. So we got a lot of information out there that people can dive into and educate themselves on.
Nice. That was
Yeah.
actually going to be my next question is how could folks find out more about you? And
TMJLA.
Check it. TMJLA.
Yeah.
I love that.
Yeah.
That's awesome. Well, Doc,
Yeah.
I appreciate you coming on, man. This was really good. I mean, we've talked about sleep on here before, but we've never touched on a lot of the things that we talked about. So I just want to say thank you for just your commitment to helping people naturally, you know, and just being willing to, you know, do whatever is necessary for that individual, you know, so that they can, you know, they can live their best life. So, and really appreciate you coming on today.
That's why I do it. Thank you so much for having me. I really appreciate you, Jason.
Absolutely. My pleasure. Thank you very much.